Hello, my name is Donna Edgel, and I'm one of the nurses here at Olean General Hospital. And I want to show you today a couple different things about childbirth. It's a little different, not being able to interact with you, but I'm going to do my very best. And if you have any questions, I believe that there's going to be a place that you can ask us at the end of the presentation if you have anything that you'd like to ask us about that. So today I'm going to start off with some baby care. We're going to do the newborn care. This is my newborn. It's kind of a generic newborn, but it is soft and it will move around for the purposes that we have for today. One of the things that I want to show you is, or talk about, is the decisions that we have to make with our baby. So some of the questions that we would need to arise is, who's going to take care of the baby when the baby comes? We have pediatricians, we have family practice people, whether you're here in the Olean area or whether you live in Pennsylvania, doesn't matter who. We just want you to be sure that you have someone that's going to take care of your baby for you whenever it comes. You can ask your family, friends, can set up appointments, interviews. You can choose whoever we have as on call, such as if you have a Pennsylvania provider. They don't attend here, but we do have other providers that will take care of your baby while they're here. We call that on call. And you don't need to contact them ahead. Your pediatrician will see you whenever you leave the hospital. It's already set up. Babies are seen 2 days after they go home, and you can just choose from there. Those are your choices. All right, so some more decisions that we need to make whenever we're talking about our baby and is how are we going to feed our baby? Are we going to breastfeed or are we going to bottle feed? It doesn't matter how you feed your baby, just feed your baby. All right, so I'm going to go over some of the things with breastfeeding. Breastfeeding you do on demand. Whenever baby's hungry, baby eats. It could be every 2 hours and no longer than 4 hours. But we try to get the baby to eat about every couple of hours there with that. Their first feeding is within that first half hour of life. And if you choose to breastfeed, we don't do any bottles or pacifiers for the baby. Okay? Some of the things that I'm going to show you with breastfeeding, and I'll do the same thing with bottle feeding, is first off, this is my pretend breast. There you go. There it is. Okay? Have a nipple. This is called the areolar. This is the area that we want the baby to get into. Okay? So if we have baby here, we're going to hold baby kind of upright with this. Baby needs to be belly to belly. Okay? I don't care if belly to belly, belly to belly, belly to belly. Doesn't really matter. Just so baby's belly to belly, they got a good position there whenever they're doing that. So if this is my breast and I've got baby belly to belly, I'm going to take the baby, tickle the baby's lip. The baby's going to open its mouth like a bird. Okay? So whenever they do that, they open their mouth, and then it's like a target practice. Okay? People laugh at me when I say that, but that's exactly what it is. So baby's got its mouth open. We go, okay? Supporting baby's head. One hand supporting the breast, one hand supporting the head. Get on there, baby goes, and you're feeding your baby. Okay? Basic breastfeeding. With bottle feeding, you're going to hold your baby, make sure baby is upright in a position like that. You're going to take the nipple and put the nipple right in the baby's mouth. Baby will suck, burp, go from there with that. Burping, there's different positions. Whether you breastfeed or bottle feed, you'll want to burp your baby. So you set the baby up however you would like. If you want to sit him on your lap, if you want to put him on your side like this, it doesn't matter. You can even lay the baby on your lap and burp him on his back this way, okay? They do get air, so they do need to get burped as far as that goes with the feedings, okay? So that's your basic feedings as far as that goes. If you're bottle feeding, the formula is your choice. If you participate in WIC, different states have different companies that they use. So we try to start the baby on whatever, if you are presenting with WIC, whatever WIC will provide for you. Baby can be fed in the nursery if you're bottle feeding during the night. If you want to feed your baby all night, that's fine too. But breastfeeding, you will be up when baby's hungry. We're going to wake you up and feed your baby. Just like at home. Nothing different there with that. All right, so some of the things that happen with baby is you have to decide whether you want the baby to have the hepatitis B vaccine. Upon admission, we give you a sheet of paper that tells you all the risks and benefits of the hepatitis B vaccines. the recommendations from the American Pediatric Associations is that the baby have that vaccine within 12 hours of life. So that's why we get the consent whenever you first come in, because after you have the baby, you're like, what? Okay. Okay, so we want it to be an informed consent. Okay. If you're having a baby boy, do I circumcise? Do I not circumcise? Again, that's up to you and that's your choice. In your booklet, it talks about circumcision. It talks about all these things that I'm going over with, and I'll give you those page numbers at a different time as far as that goes. But circumcision, if you choose to have your child circumcision, it's done after baby is 24 hours old. You have to sign a consent form. We do use anesthesia to do that, so don't have to worry about that. Baby stays usually for about 4 to 6 hours after the circumcision to make sure that there aren't any problems, that the healing, that it's starting to heal, that it's not going to be bleeding too much. And a lot of moms and families are opting to stay for like 24 hours, and they want to go home in a 24-hour mark. Just to be on the realistic side, it's going to be closer to 36. By the time we get all the testing done and alike, that it's going to be closer to 36-hour discharge than 24. Okay, just so you know about that. To care for the circumcision, we use Vaseline. We have that, and I will show you on some more slides, and it heals about 2 weeks. All right, these are some pictures to the left there of a circumcision. This here is an uncircumcised penis and scrotum of a newborn. Okay, this one here is a newly done one, and you can see it kind of looks like a cherry on the top. And then this is one that's healed. Okay, circumcision is your choice, and the physicians that do the circumcision will get an informed consent from you. They'll go over all the risks, all the benefits of having a circumcision. Once the baby's here, you have a choice whether you want to room in with the baby and have the baby with you for 24 hours the whole time you're here, or whether you want the baby to go to the nursery to give yourself a rest. If you have a C-section, the baby can't, that first night, it's really hard unless there's somebody in that room with you. We don't recommend a baby staying with you because you can't get out of bed to take care of the baby should the baby start choking or something along that line. So we do ask that somebody else be with you there with that for that first night if you do happen to have a C-section. Okay? Baby can stay with you as much or as little as you like. But we do bring the babies to the nursery for assessments. The pediatricians like to look at there, and that's where we have our equipment to be able to do those assessments. Okay, so we're getting ready for delivery, and these are some of the routines that we have when the baby comes here at the hospital. Baby is going to be placed on your belly or in the warmer. It's usually on your belly as far as that goes. The cord is cut, baby's dried. We make sure all the secretions are out of their mouth, all that sort of stuff. So whenever they cry, we like a crying baby in labor and delivery. Just telling you, a crying baby, it's a good baby. If it's not crying, we want to make it cry. So I know as a mom, you're going to go, oh, it's okay, it's okay. Yeah, it's okay to cry. We're good. Okay, you can cuddle and do that stuff later. Okay, we're going to keep baby warm. We're going to put a hat on the baby's head. We're going to swaddle the baby. And we swaddle the baby with blankets. Ah, almost lost the baby. Don't want to do that. Putting the blanket, these are your normal receiving blankets. Okay, you're going to take one side and make a triangle. Okay, this is how we swaddle them. Then we're going to put baby's shoulder at the top of the blanket. Okay, take one side, flop it over. Take the bottom and flop it up. See, now this is the nice burrito that you've all been reading about and taking care of there. And then we're going to do the other side like that. Your baby is nice and swaddled. It's going to keep them warm. They're used to being in a nice tight place. This kind of gives them comfort for that. So that's how we swaddle the baby. And we will show you that more when you get here as far as the swaddling goes. But just so you know, that's what we're going to be doing with the baby. Okay. We're going to give them an APGAR score sign, and that just does a whole bunch of different, as you can see here on this one, what we grade them on, so to speak. We rate them on their heart rate, what their color looks like, whether they're breathing, what their muscle tone is, and what their reflex is. So according to how they do, that's how they get their lovely points. Okay? Most babies score between 7 and 10. It's very rare that they get a 10, just saying, because they usually take a while to get pinked up to do the crying and that sort of thing. Once baby has been born, you're usually in the labor room for about an hour for the recovery period. Make sure that mommy's bleeding's okay. And we'll go, sort of gone over that with the stages of labor, the last stage of labor, the 4th stage. We have a 4-band system that we use. Baby gets 2 bands, one's on its arm, one on its leg. Mommy gets a band, and then whoever mom designates is the other one. This identifies the baby by number with that mommy and that baby, so we're making sure that that couple is as it should be, and you don't get somebody else's kid. Okay? We're gonna footprint the baby. You're welcome to bring your cameras. You're welcome to use your phones, take all the pictures that you want. The video part, we just don't video the actual delivery. We can video the baby all you want and everything going on there, but I don't think mom would appreciate you videotaping her giving birth. Just saying. Okay. We give the baby medications upon birth. 2 of those are aquamaphytin or vitamin K, and the other is an eye ointment called erythromycin. Those are both preventive medications that we use in labor and delivery within the first 6 hours of life. We're going to give those to them. You're going to hold, bond, nurse your baby, do, well, basically whatever you'd like in the delivery room. Okay. Eventually the baby will go to the nursery where we do the measurements. We measure baby's head, chest, and length, as well as we weigh them on the scales. We may check the baby's blood sugar, make sure that baby's blood sugar is okay, especially if mama's had diabetes or gestational diabetes, or the baby's early, that sort of thing, or the baby's just a little jittery going, I need some food. It'll show us, so we'll do a blood sugar there with that. We will also give the baby its first bath whenever you're ready for that. And we do put a security band on the baby. Once the baby gets to the nursery, it is signed in a security band. That number goes in our system. And believe me, it's not a good sound whenever the band comes off or somebody tries to get the baby too close to an open door. It sounds like an air raid siren. There's no way any child's going to get off the floor once it has its security bracelet on. Okay, so those are some of the safety measures that we have here. So what does my newborn look like? What is it going to look like? Well, when it first comes out, it's going to look like a Smurf. Okay, for those of you who know what a Smurf is, it's going to look like a Smurf. Blue as all get out. It hasn't gotten its oxygenation, its circulation yet from crying. So beware. Okay. What can you expect? All sorts of things. First off is the umbilical cord. Now the baby that I have over here has a kind of a wadded up umbilical cord. This is really gooey and it's very flexible. Of course, this one isn't. That's there. And that's where baby was getting all of its nutrients while it's inside mom. It's cut and there's a clamp that's placed on it. It will fall off in about 10 days to 2 weeks. When you change the diaper is when we do the cord care, and I'll show you that in just a minute. When it falls off, there might be a little bit of blood that comes off. You know, kind of like when you got a hangnail and you got a little bit of blood there. That can happen whenever the baby does its umbilical cord, whenever it falls off in about 2 weeks. Baby is not going to go into a tub until the cord is off and completely healed. Again, that's 7 to 14 days, just depending upon that way. We are going to bathe the baby by doing it with a tub bath, so to speak. A basin, my grandparents used to call it a spit bath, okay? Where you just use it at the kitchen sink and use a washcloth, not actually immersing anybody in the tub. This is what the cord clamp looks like, this yellow thing here. And see how that looks like yellow-ish? That's what the cord looks like when it first comes. And then this is what it looks like when the cord is off. You can see the cord marks there. this is going to dry and fall off. Okay? When we're doing cord care, we have little squares of alcohol that we take and we put around the skin here at the stump, they call it. So these pictures aren't the world's greatest, but it's what we got. All right. So babies can have, we call it acrocyanosis, blue hands. See how the feet are a little more pale and the hands a little more pale than the body of the baby? That's normal. Again, circulation going, baby's got to get that circulation, get it crying, get going, baby will pink up very well. Baby can have what they call lanugo, which is a fine, soft hair all over their body. Kind of can look like a monkey, okay? That's what a lot of moms say. It's like, oh, I had a little monkey. Yep, nice hair, but it's very soft, and that's what gives the baby the soft feel. Whenever you touch a baby and they feel, oh, so nice and soft, that's what does it. Okay. Babies can also have what they call vernix, which is a white, creamy coat. This is what's protected them while they're inside the womb with all that amniotic fluid in there. This is what's kind of kept them from getting all wrinkly like an old lady or whenever you sat in a bath for too long. Can you imagine sitting in a bath for 9 months? Okay, yeah, you're gonna be wrinkly at the end. So it kind of looks like cold cream on the baby, and it absorbs in closer to your due date. So if you have like a 36-week delivery, you're gonna see more of the vernix than if you're a 41-week, okay? And like this one here, you can kind of see the whiteness on the arms and the like. That's the vernix, okay? It's really hard to get off. It's very hard to bathe them. And that's what it was designed to do, keep water off. Okay. Additional normals that we have, head could be molded. You could have a pointed head baby and look really long. Woo. Okay, that's from the baby coming out the birth canal. Totally normal. Even within an hour, that baby's head's going to look a lot more normal than what it had before. Okay, we call that molding. There's also what they call capit, which would be just like a little spot where you could tell where baby was just sitting there on the cervix for a while. Okay, that's a little swelling area, and it's going to take a couple days for that to absorb. Okay. Let me go back here. All right, so these are some pictures of the molding. So you can see how the head is elongated here. Okay, and see how this one isn't at all elongated. Okay, nice round. That's a C-section baby. It didn't get squished at all. Okay, and this right here, you can see a little. It looks like a goose egg. That's the capit. Okay. Sometimes the providers have to use methods to help the baby come out, one of which is a vacuum. And no, it's not a Hoover or anything like that. We call it a kiwi, is one of them, as far as that goes. And it's a device that goes on baby's head to help pull the baby as you push the baby. Sometimes it leaves a mark on the baby. As you can see, these little round area here, okay? That's a vacuum that we can tell that the baby was used with a vacuum extractor. It goes away in a couple of days. Okay. The older the baby, the more dry the baby is. So you can see the little dryness here, dry skin, a little bit there with the feet. That's not the greatest picture, but it'll work. You can put lotion on your baby. That's fine. Not a problem there with that. But that, again, normally happens the further along you are, closer you are to your due date. Okay. Sometimes baby have Mongolian spots. Now if you look here and you see the blue here and here, what's one of the first things you think of? Oh my gosh, they've got a bruise. How did they get a bruise? It's not a bruise. It's just the coloring that happens, dark coloring along that way. They tend to fade over several years, okay? But they're more common in African American, Asian, Italian, the darker skinned Puerto Rican, Mexican, Hispanic, more so than your Anglo-Saxon, white, blonde hair, blue-eyed people, okay? And like I said, it's not bruising, it's just a dark pigmentation that happens with that, and they fade and they go away. Sometimes babies come very fast. When they come very fast, they tend to bruise their faces as they come down. I say that they come down the runway running and they go before they come out. Well, when they hit that bottom there, they bruise their faces, okay? And they look like blueberries, okay? So if you can see how this baby's face does look really, really darker, bruised, common. There's also what they call a newborn rash, okay? It's different than a rash, say, of chicken pox or something along that line. They give it a technical name, but it's basically a newborn rash. It happens, it doesn't bother the baby, it just looks like really bad. This is not even a bad picture of it, but it looks like little red splotches all over baby. That's normal. It says it occurs by 2 to 3 days of life. Sometimes there's white spots surrounded by redness. I think that's Umbilical, and I'll show you that. But basically, there's no treatment required. The rash will eventually disappear over a few days, but they can come back over the next few weeks. Okay. This is what I was thinking they were talking about, the milia. Looks like little white dots all over the place. Okay. Usually on the nose and around. That can be here around the mouth and the like. But they're basically that vernix that got stuck into the pores of the baby's skin. Okay, so it kind of looks like they got whiteheads all over the place. Okay, just leave them alone. Don't try to dig them out. Don't try to mess them out. As the baby grows, though, it's going to come out of the pores. Okay, they just had very good pores and kept that vernix in there for them. Okay, salmon patches, or more commonly called stork bites. They can happen usually anywhere on the face. They can happen on the forehead, the back of the neck. The ones on the forehead they tend to call angel kisses. Why, I don't know. And the ones on the back, stork bites, because there's a little V. And this, I'm not seeing it so much in this one here, but it's typically a V mark here at the back of the neck. They become less intense with time, and you usually can't see them by the time they're adults. You never even knew that they had one. Angel kisses are usually, like I said, over the eyes. They present at birth and they generally fade over a couple months again. Again, I'm just going over some of the normal newborn things that you might see with your baby. Okay. This is, they call it urate crystals. One of the characteristics, we call it brick dust urine. Babies are born with an extra amount of red blood cells, kind of help them transition from inside outside life. As those red blood cells get broken down, sometimes there's too much and it comes through in the urine. That's the kidneys and the liver's job to filter that out. So you could see in the diaper, as you see here, some red marks here, okay? That can be very, it doesn't hurt the baby doesn't know it, but we just know that baby is breaking down its red blood cells and going for there. So again, pinkish, orangish, normal. Sometimes babies will have a mini period, baby girls, okay? And there might be a little bit of bleeding on that. That's from mama's hormones going through into baby. It's typically one time you might see a little bit and then not again to puberty. So don't worry, okay? It's not coming back until puberty. You got some time there with that. Baby boys usually have very swollen scrotums, okay? It has nothing to do with their manhood. Sorry, dads, just not. Again, it's mom's hormones going through that make them so big and alike. So this is a picture of that vaginal discharge that I was telling you about earlier that can happen with baby girls. Okay. So we're moving on to some of the normal reflexes that baby have. Okay. We call this a startle reflex. Have you ever seen a baby and the baby goes, okay? That's a normal reflex. Babies react with their entire bodies. Whenever you burn yourself on the stove and you reach for that, instantly your hand comes back, right? Babies, not so much. they're hurt or they're touched and their whole bodies react, not just the part that is touched. That's part of growing and how we all grow into our nervous system, okay? But just so you know, babies are going to react with their whole body. So this is a startle reflex. Some of the other reflexes that they have, and I don't think I have a film for it, include they're fanning their toes whenever we touch their feet. Whenever we stand them up, they'll stand, almost stand walking. Of course, we got to support their heads, but they'll almost walk. Sometimes the babies will almost even walk, as far as that goes. And that's just checking their normal reflexes, okay? Do they hold their head up? Do they not hold their head up? Those are some of the things that we'll be assessing in the nursery when they come. Sometimes babies get yellow. Now this is a great yellow color that the babies get, okay? Even your dark-skinned babies can have a yellow tinge to them. They call that jaundice, okay? It is caused by the breakdown of the red blood cells in an immature liver. Usually that happens for premature babies. If that baby's come down really fast and bruised himself, okay, it's got lots of bruising going on, you're going to see this a little bit sooner than you would otherwise. Treatment is phototherapy. Ultraviolet light helps break down the bilirubin so the babies can pee it and poop it out. Okay. For that, we have a little incubator thing that we kind of put the baby in with lights and the like. That's again advanced treatment, and if your baby needs that, it is normal to get the jaundice, but the treatment is also normal, and they usually stay a little longer if they have to be treated here at the hospital. Okay. Some of the tests that we're going to be doing with the babies before they go home include, but are not limited to, a hearing screen. Every baby gets a hearing screen. We want to make sure that the baby has hearing capabilities. That is, they have found that if they can catch that early enough, babies aren't as delayed in their growth as they would be if we waited later to get it screened and found out that the baby couldn't hear you. And they've got lots of good things that they do with that, but that's why we screen for hearing. If the baby doesn't pass while it's here, we'll schedule you to come back in a week and retest the baby and go from there with that, okay? It's not uncommon for them to not pass the first time. By that week coming back, them not passing, then that's another story. But we'll get that another day. All right. We're also going to do a PKU or a blood test that's mandated across the country. There's a 20 different tests at least that they do with 5 circles of blood. Okay. That will be done. We have to wait until the baby's 24 hours to do that. So again, that's why we're closer to the 36 hours getting done than the 24 as far as going home early for discharges. We also are going to, for some of the safety stuff, in New York State, it's mandated that you have a safe car seat to take the baby home in, okay? There are places that will check to make sure that the car seat is installed properly, that sort of thing. Our job is to make sure that the car seat is a good car seat and that the baby is fit into it well. If baby is early, they will do a car seat test where they put the baby in the car seat for 90 minutes. We put on the heart monitor, make sure the baby's heart rate's okay. We put on a little pulse oximeter, make sure its oxygenation's okay, and we let the baby sleep in the car seat for 90 minutes. Okay, they pass the car seat test, you're good to go. They don't, we have other alternatives, but the baby will be tested that way for car seats. For safety stuff when you go home, babies are to be on their back when they sleep and nothing in the crib. They're recommending no stuffed animals, no crib bumpers around there, nothing but baby. They are also recommending that we do a swaddling things so that there's no blankets in the cribs either, is their recommendation. So they have onesie type things, and I think you've probably seen them already as far as the babies go in. And again, this baby is really good because he's holding his head up really nice for me. So you put the baby in with that, zipper it up, and then we can swaddle it with the lovely flaps that you can never figure out because they're too long or too short as far as that goes. Okay, so that way baby is alone in the crib, they're swaddled, and they're not going to slide underneath their blankets. Some of the things with SIDS, that's what they found, is if you have the baby in there, as baby sleeps, baby slides down and can suffocate and do that way with the blankets. So that's why they say alone on your back in the crib, okay? Not sleeping with mommy or daddy or aunts or anything like that. You're gonna make sure that baby's on a firm surface. You're not gonna smoke around your baby, right? Yep, no smoking. Avoid overheating, have a fan in the room. It's hot now to begin with. You're gonna dress the baby the way that you would dress. Okay, now I'm not saying like if you go to bed naked, you don't want to do that with baby. You do want a little something there, just saying. And we do have a thing for tummy time for babies. Tummy time is putting baby on your tummy. This is considered tummy time. Putting the baby on its belly for a little bit is tummy time. You're not going to put the baby to sleep on its belly, but you do want to give it some time on its belly so that it can learn to get their head muscles and their neck muscles developed and strengthened. Okay, so it's a little both worlds. You don't want them to sleep that way, but you do want to give them some time for that. We're also going to give you information about the shaken baby. You don't want to shake your baby. This is not good, okay? Things go awry in this. If you're angry or you're very frustrated and you don't know what to do, baby is just crying up a storm. Place the baby in its crib. Okay, this is very hard to do, especially for the moms. Dads, not so much. They're like, yeah, whatever. Put the baby in the crib. Baby's safe. Baby's not going to go anywhere. Baby can just cry. You go out of the room, walk around the house 2 or 3 times, come back, and then deal with baby. Okay? There's a difference between neglecting your baby and not taking care of it and taking 5 minutes so that you're not frustrated and not shaking your baby. So take that time. Don't shake your baby. And this is where the questions would come in. One thing that I didn't show you is diapering, okay? Nobody showed me this as a first-time mom, so I'm gonna show it to you, okay? They come really easy now. They have a front on the diaper and a back on the diaper. You'd be surprised. It's very complicated. Usually the tabs go in the back, okay? So as you are diapering your baby, put the tabs in the back, put the baby on like that. Again, this is a stiff baby. Your baby will not be this stiff. Okay. This comes up and around. Okay. With the umbilical cord, you can turn it down to get it air because you want it to air so that it will dry out a little bit. Then the tabs come around this way and the tabs come around that way. That's how you diaper the baby. Okay, so what I'm going to show you now is how you are going to give the baby a bath once you're home. When you're here in the hospital, we're going to show you how to do that spit bath type thing, as my grandparents used to call it. Once you're at home, you're going to use a basin or a tub, or even the kitchen sink works. You don't have to have a fancy tub to bathe the baby. One caution that I want to let you know is once these babies are wet, they become slicker than snot, okay? They will just slide all over the place, and before you know it, boom, they're down in there. So my recommendation, what I tell new moms to do is take your hand, if you're right-handed, left-handed, whichever one, hold on to the baby's thigh, okay? You can still put yourself down in the water. You can still support baby's head. Yes, your arm's getting wet, but hey, you need a bath too, right? Okay, so that's what you want to do is you want to be sure that you got the baby secure so the baby is not going to go anywhere in the tub, okay? Baby's in there. When you're doing the baby, always do the face first, but you don't want to use any soap, okay? When you're doing the baby's ears, you're going to take the edge of the washcloth, and I'm just using a blanket here. No Q-tips, okay? Nothing like that in the baby's ears. And do it that way. Then you're going to take another part of the washcloth to do the other ear, okay? You want to do that so in case there's infection in one ear, you're not spreading it to the other ear. Same thing with the eyes. You're going to start at the bridge of the nose and wipe out. Different part of the blanket, bridge of the nose, out to the ears. Okay? If they're stuffy in their nose, you can put a little washcloth up there and stuff it up that way. Whatever. The baby's going to cry it out, snuff it out. Let them go for it. All right? There's also wrinkly areas. Okay? And this baby is great to demonstrate it. And no, you're not going to hold your baby like this. Okay? Is under their arms. They've been in the womb like this for a long, long time. And they like that position. So to get them to move their arms out so that you can get underneath to get that stuff can be a little bit of work. Okay? So what you need to do is you just take the baby and move it a little bit. Give them a second to know that that's okay. Move the baby again. Okay? Until you're at the area where you can get it washed. You're not going to take and jerk the arm up and get that resistance, okay? Just be patient with them and they will move. They will relax for you to be able to move them. Great places are under their chin, okay? So you might have to do one of those numbers to get it out underneath the chin, okay? In the groin area, behind the knees, elbows, armpits, okay? That's going to be where they are. Now these babies aren't jumping out in mud puddles at this point in time. So a bath every day isn't necessary. Every 2 to 3 days is probably sufficient because you don't want to dry their skin out. And like I said, they're not out drying, jumping in mud puddles. And you're cleaning this area every time anyway, every time you change a diaper. Okay? So that's about it as far as bathing and the like goes. I showed you how to swaddle. When you're done with the swaddling, we're going to make our triangle. One side over. And it doesn't matter what side. One side over, and this kind of helps tuck their feet in if you put the bottom up next and then swaddle them. Okay. To do their hair or their head, you can use the warm water from the sink. You can make it like a little shower. You can support their head, and this one's a little stiff as far as that goes. So if this were my sink and I have the faucet coming through that way, put the baby underneath and just gently wash baby's head. Okay. Get behind the ears. Okay, that way baby is tight, he's snuggled, and he's not trying to help you wash his hair. So I think that wraps us up for doing the newborn care and what to expect for the newborn in the first time whenever they're first born and the like. If you have any questions or anything along that line, I'm going to refer you back to our website and where you can type in and do questions there that somebody would answer your questions in that amount of time. I hope this has been informative and that you have learned something from this presentation. Thank you.